Now, okay, infusion set insertion device. So this is a type of insertion device which going to be used for injecting your insulin into the body. Okay, with the help of button you can easily penetrate into the body. Then here it has some design feature, that is your insertion device, that is infusion set can be easily wearable device with the comfort for long period, and also it can be able to carry with your normal living conditions either inside and outside the clinic. அதே மாதிரி patient can be able to do the normal works by wearing this device. And then it is very easy and safe to operate both by your physician as well as by patient. Okay, then all infusion path is nothing but where the insulin comes from and reach, okay, reaching point, that is from the um, storage device of storage of your insulin to patient will be called as the infusion path. So that infusion path will be practicable one and possible one, so it will not have any difficulty to reach. So the pump must have sufficient supply pressure reserved to prevent possible catheter clogging. So sometimes the catheter clogging is possible in the device. So that will be avoided by using the pump, that is insulin pump, which will be providing the pressure to the device. Okay, to make the device to, that is your catheter to avoid clogging. Okay, clogging of insulin. And then the highest possible level of patient safety must be assumed. So by using this device you can avoid the all dangerous thing. Okay, it is very safety. And then malfunctioning of the device must be excluded, so as far as possible, or must be signaled immediately to the patient and must never lead to dangerous overdosing. So we have to use the device properly, that is periodically you have to use, so overdose would be avoided, that is so you have to set the proper dose level as well as timing, periodic timing. So in the interval குள்ள இந்த இத்தனை dose தான் கொடுக்கணும். அடிக்கடி you should not give the insulin dose. Okay. So, in order to fulfill these requirements, a stepping motor driven roller pump with the spring out counter jaws is employed as a pump. So, to avoid all these disadvantages, we are going to use a stepping motor driven roller pump. So, stepping motor stepwise it will be working. So, here you are going to use counter jaw. So, counter jaw will set the timing periodically. You have to give the insulin. That timing will be set by the counter device used in the pump, insulin pump. The device is of the demand rate type, that is on a preset basal rate, a supplementary dose of insulin of selectable size is called up by the patient at mealtime. That means on the demand rate type means, so based on the patient you will be selecting the dose as well as the timing. Okay, uh, in between the time only you are going to provide the insulin. So it is based on the patient, you are going to select the time as well as the dose of your insulin. Okay, that is the point of this demand rate type. On the demand only you are going to be provide the timing as well as the dose of insulin. The insulin reservoir consists of a collapsible laminated foil bag and forms a one-trip article together with the attached silicone pump tubing. So the insulin reservoir is nothing but like tank-like material. Okay, that is the cartridge, plastic cartridge, which going to be consist of collapsible laminated foil bag. Okay, so laminated foil bag. இருக்கும் ஒரு லேயர் மாதிரி, then unforms a one trip article together with the attached silicone pump tubing. Have you understood? Collapsible laminated foil bag means it is a layer, okay, which will be laminated in the reservoir with one trip particle together. Okay, forms a one trip article which will be attaching with your pumping device. I think you all know the diagram. This is reservoir. Here you are going to have a layer. Okay, a layer. Uh, Through that layer, you are going to connect with your pump. Okay, is giving you. The catheter can be connected to the pump tubing with a standard connector. So again, on the other side of the pump, you are going to have a catheter. Okay, one side it will be connected to the reservoir, and another side of the pump will be connected to the catheter. Then a number of alarm under safety circuits ensure that a dangerous condition cannot occur. So you will be having the alarm and safety circuit in the device itself. So it will be giving the alarm signal for the unexpected conditions. Okay, it is in case of failure of the system component, which would lead to unintentional overdosing, the pump is automatically switched off and an acoustic signal is triggered. So in case if your devices fail to work, then what will happen? It will to avoid the overdosing of insulin due to failure of the device. Your pump automatically will switch off. Okay, when your device is enters into failure condition, the pump automatically will switch off so that it will be indicating the sound signal. Okay, to so the system failure. Okay, that is acoustic signal is nothing but sound signal. Alarm will be produced on in the case of failure. So in this manner, it can be used with the safe and are also very securable and easy wearable device is insulin pump. Okay. Any doubt in insulin pump? ஸோ இன்சுலின் பம்புங்கிறது நார்மலாக பேஷண்ட்ஸ் வந்து அவங்களா இன்ஜெக்ஷன் எடுத்துக்காம இது வந்து ஒரு டிவைஸ் மாதிரி யூ வில் பி வியரிங் இன் யுவர் பாடி லைக் எ ட்ரெஸ் ஓகே ஆர் லைக் எ வாட்ச் ஓகே ஸோ தட் இட் வில் பி பீரியாடிக்கலி without your knowledge it will be giving dose to your body. Okay, so you sometimes you may forget to take the insulin. At that time on wearing this device it can be maintaining the timing for the diabetes patient. Okay, this is the most advantages of using insulin pump device. Okay, next topic, endo microscopy. What is endo microscopy? Anyone aware of the title? Endoscope, endo microscope. Okay, here we are going to use the optical fiber for communication purpose. And then optical fiber will play a vital role in the medical field. Endoscope or fibroscope. So here completely we are going to use the optical fiber cable. That's why it's called as fibroscope. Are designed with a low quality, large diameter and soft silica fiber. So the fiber used here is a low quality, large diameter and soft silica fiber. Okay, made up of silicon fibers. So broncho fibroscope, gastrointestinal fibroscope and laparoscope are the important endoscope. Uh, Simpler சொல்லணும்னா endoscope is nothing but something tube tube like device which will be inserted into the body for doing operations. Okay, any surgery will be done without opening fully opening your body. Okay, see, on inserting the tube, it will do all the works. Okay, that is called as endoscopy. Okay, so for example, if you want to remove any blocks in the heart without opening the heart, okay, you can clear that block by doing the endoscopy manner. Okay, inserting some tube inside the heart. Okay, connecting into the heart, you can clear the blocks of the heart. Okay, that is said to be endoscopy. இன்னொரு எக்ஸாம்பிள் கூட சொல்லலாம் யூட்ரஸ். ஸோ யூட்ரஸில் எனி ப்ராப்ளம், if you are having any problem in uterus, that can be cleared by laparoscopy. It is laparoscopy. Okay, gastrointestinal fibroscope na in the what to say, in the stomach. Okay, laparoscopy na uterus, gastroscopy na in the stomach surgery. Then bronchofibroscope means your lungs. Okay, so these are the types of endoscope available. Most important endoscopes. Then endoscopes are used in hospital for examination, treatment of disease, and also for surgery. So endoscope எங்க யூஸ் பண்றாங்கன்னா to examine for testing purpose, as well as for treating the disease, as well as surgery. Okay, without opening your part or body, you can do the surgery. So there are two types of endoscopes: flexible one and rigid one. So in each endoscope, there are two fiber bundle. So whatever endoscope method you are going to involve, that is based on the parts of the body, the types will be defined. That is heart na or name, lungs na or name, அதே மாதிரி uterus na ஒரு name, stomach na ஒரு name. அது மாதிரி எந்த type of endoscope நாலும் what you are going to have, you are going to have two fiber bundle. Okay, so one bundle is used to illuminate the inner structure of object, and other is used to collect the reflected light from that area. Okay, so one fiber will illuminate, will send the light. Okay, will send the light to that inner structure of any part. Okay, ஸோ இன்னொரு டியூப் என்ன பண்ணும், அந்த சென்ட் பண்ண லைட்டை அங்கே என்ன ஆகும், பார்ட்ஸ் ஏதோ ஒரு பார்ட்ஸில் லைட் சென்ட் பண்ணினா வாட் வில் ஹேப்பன், இட் வில் பி ரிஃப்ளெக்டட். ஓகே, ஸோ தட் ரிஃப்ளெக்டட் லைட் வில் பி கலெக்டட் பை த another fiber. Okay, so totally two fiber will be available. One will send the light signal to the particular inner part. Okay, so that is the word illuminate, sending the light to the inner part. And that light will be reflected. So the reflected light will be gathered or collected by the second bundle, fiber bundle. So from that we can view the inner structure of object. So the collected reflected light will show the inner view of your inner parts. Okay, so endoscope is an optical instrument to view the body cavities which are not visible to the naked eyes. So normally naked eyes la தெரியாத இடம்லாம் you can find out by using the endoscope. Okay, it will be representing the clear view of your inner part, inner structure of your parts, organs. Partsங்கிறத விட organs. And then endoscope can be inserted to inspect or view the body cavities. So you can view the cavity as well as inspect. Inspect means you are going to detect any problem. Okay, in the uh, organ. So the body is filled with air to improve optical transmission. You are going to fill the body with air to improve the optical transmission, to get the clear view. The light is guided through the glass fiber by total internal reflection. I think you all know the fiber communication. Have you learned optical fiber communication? if you learned means their important term used in that topic is total internal reflection, because your fiber going to work under the principle of total internal reflection. So in the fiber cable internally it will be reflected to get the signal. Okay, that is the total internal reflection. So a typical glass fiber consists of a central core glass having high refractive index surrounded by a cladding made of glass of slightly lower refractive index. So your fiber cable structure, how it will be looking means, you will have central core glass as well as cladding. Okay, central part will be called as core, and then next layer will be called as cladding. Okay, that the central core will have high refractive index. Okay, but cladding layer will have lower refractive index. Okay, refraction property will be low in the low cladding layer, but in the center part, that is center core, you'll be having high refractive refraction property. Okay, that's the meaning of refractive index, high and low. Then numerical aperture, light collection efficiency. So numerical aperture nothing but the word or term which is used for efficiency of your light, which is collected from the organ. Okay, so the numerical aperture of the fiber is equal to n1 into 2 minus n2 into 2 divided by half, sorry, divided by 2. So where n1 and n2 are refractive index of core and cladding respectively. Okay, refractive index of core and cladding is n1 and n2. So for better image quality, a telescope system is added in the internal part of the endoscope. So to get better image, you are going to add telescope system along with your endoscopy. Okay, so through the telescope you can view the image clearly for your eyes. Then reflected light rays are collected by CCD, charge coupled device, and electrical signals are produced. CCD is nothing but it works like a digital camera. Like, okay, this it will be taking the image of your internal organ. Okay, so image is taken by the reflected light which is received through the optical fiber cable, second part of the optical fiber cable. So that light will be um, uh, that light going to provide the image of your internal organ. Okay, and the electrical signal are converted by the CCD device. Okay, so the the light, reflected light going to be converted into a corresponding electrical signal which will be fed to the video monitor to get the image. Then through one channel of endoscope, water and air is conducted to wash and dry the surgical site. So through the one more channel, that is another one fiber cable, you are going to send the water and air to clean your um surgical part. Okay, you will be doing the surgical works, no, you will be cutting the part or removing, blood will be leaked out from the cutted part. Okay, that will be cleaned by the another channel of fiber cable. And then a surgeon introduces the endoscope into the body either through a body opening such as the mouth or the anus, or through a small incision in the skin. So endoscope வந்து without opening your body ன்னு சொல்லியாச்சு. So then how you will be injecting that endoscope fiber cable to the body? Either it will be injected or inserted through the mouth. மவுத்துக்குள்ள உள்ள விட்டு எடுப்பாங்க. இல்ல anus. Anus means I think no another part of your human body. Waste material will be coming out through that part, and then and through a small incision means they will be cutting a small part. சின்ன சைஸ் தான் கட் பண்ணுவாங்க எங்கேயாவது. ஓகே, இப்போ ஃபார் எக்ஸாம்பிள் ஸ்டொமக்ல இஃப் யூ வாண்ட் டு டூ த எண்டோஸ்கோப் மீன்ஸ் ஸ்மால் ஓப்பனிங் வில் பி டன் லைக் what to say ஒரு 2 inch சைஸ்ல வந்து they will be doing the cut. Okay, along across your stomach for doing the endoscopy in your stomach. Okay, so these are the openings of your body opening for doing the endoscopy. Okay, then endoscope gives visual evidence of the problem such as ulceration or inflammation. It can be used to collect a sample of tissue, remove problematic tissue such as polyps. So um, maximum you will be using the endoscopy for the problems of ulcer, or any inflammable part, that is wounded part, இல்ல அழுகி போயிடுச்சு, ஒரு என்ன சொல்லுவாங்க, கட்டி வந்து அழுகி போயிடுச்சு, ஏதாவது ஒரு சதை வளருது, அந்த மாதிரி ப்ராப்ளம்ஸ்லாம் இருக்கும் இல்லையா? கட்டி வளருது, சதை வளருது, கட்டி அழுகி போயிடுச்சு, இல்ல அந்த இடத்துல காயமா இருக்கு, காயமா இருந்தா அந்த அது வந்து மேக்கிங் சம் ட்ரபிள், இந்த மாதிரி இடத்துலலாம் யூ வில் பி எம்ப்ளாயிங் த எண்டோஸ்கோபி மெத்தட். ஓகே, so which will be easily removable without doing any max what to say big surgery. Okay, so body வயிற்று ரொம்ப பெருசாக கிழிச்சு தான் ஓப்பன் பண்ணி இந்த இதெல்லாம் ஆப்ரேஷன் பண்ணணும்னு அவசியம் இல்லை. ஒரு ஸ்மால் கட் பண்ணி அந்த டியூபை இன்சர்ட் பண்ணிங்கன்னா யூ கேன் டூ ஆல் திஸ் operations easily. Okay, so recovering time will be very minimum on doing the endoscopy. Okay, major operation பண்ணீங்கன்னா சர்ஜரிஸ்லாம் பண்ணீங்கன்னா recovery time will be very long period, but if you go for endoscopy method means the recovery time will be very low. Okay, because small part only going to be cutted, just they will do the plaster after doing the surgery. Okay, அந்த small part அப்படி காயம் பட்ட அப்படி plaster போட்டுக்கலாம். அந்த மாதிரி ஒரு plaster போட்டுட்டீங்கன்னா you can do automatically your normal work after few days itself. ஓகே, இல்லை ஒரு மேஜர் சர்ஜரி பண்ணால் யூ ஹாவ் டு டேக் த பெட் ரெஸ்ட் ஃபார் லாங் பீரியட். ஓகே, அது அவாய்டபிள். இதுதான் மேஜர் அட்வான்டேஜஸ் ஆஃப் யூஸிங் த எண்டோஸ்கோபி. அண்ட் தென் இட் இஸ் யூஸ் டு டேக் ஃபோட்டோகிராஃப் ஆஃப் த ஹோலோ இன்டர்னல் ஆர்கன். ஸோ த்ரூ த எண்டோஸ்கோபி மெத்தட் யூ கேன் டேக் ஹோல் organs, internal organs, any organ photography, that is image can be viewed through this method. In the endoscope, at the object end, there is an assembly of objective lens and prism, and viewing end, there is an eye lens. So, in the endoscopy, what are the lens used? That is objective lens, prism, eye lens. These are the lens going to be used for taking the image. And then endoscopic picture can be recorded with the color film and videotape recorder. So, after taking the picture of your internal organ, it will be recorded with the color film, and then and also you can use the videotape for recording it. Okay, this is the flexible endoscope. This is observation using endoscope. So இது அப்படியே உள்ள பாடியில் இதை இன்சர்ட் பண்ணுறதுக்கு ஒரு ஸ்மால் 2 inch surgery is enough. Okay, so through this only you are going to see the internal organ parts. This is the rigid endoscope type. So here we are going to see the different types of commonly available endoscopes. These are the types of endoscope: bronchoscope, cardioscope, cystoscope, gastroscope, laparoscope, ophthalmoscope, otoscope, proctoscope, sigmoidoscope, thoracoscope. ஸோ எந்த பார்ட்டில் நம்ம எண்டோஸ்கோப்பி யூஸ் பண்ணுறோமோ அதுக்கு ஒரு நேம், அதுக்கு ஒரு டைப். தட்ஸ் ஆல். ஸோ ப்ரோங்கோஸ்கோப்னா simply it is used in the lungs. Okay, so trachea, larger airway. I think you all know trachea is a part of the lungs. So here the infection can be removed by using the bronchoscope method. So infection na infection is nothing but if you have frequent cough or cold, um, then it can be removed. Okay, that can be easily removed by the bronchoscope method. Okay, then cardioscope. This is cardioscope na na heart. Okay, you're going to remove the any heart blocks, any disease. Okay, you can do it by cardioscope in the heart. Cystoscope na na urinary system, your kidney. Okay, ஸோ அது வந்து டியூமர் ஏதாவது அழுகி போன பார்ட் இல்லைன்னா ஸ்டோன் ஃபார்மேஷன் இந்த urinary bladder, that is kidney, that can be removed easily by the cystoscope method. And then gastroscope na stomach. Okay, அந்த குடல் வளர்ச்சி, குடல்ல ஏதாவது புண்ணு இருக்கு, அல்சர் ப்ராப்ளம், anything else. Okay, if you want to do anything in the stomach, it will be done by the gastroscope. And then laparoscope. Laparoscope na abdominal cavity. Abdominal cavity na um, like family planning லாம் பண்ணுவாங்க இல்லையா? ஸோ ஃபேமிலி பிளானிங் மேஜர் சர்ஜரி பண்ணணும்னு அவசியம் கிடையாது. ஃபேமிலி பிளானிங் லேப்ரோஸ்கோப் மூலயமா யூ கேன் டூ இட் சிம்பிளி. ஓகே, ஏதாவது அந்த இதில் கட்டி வளர்ந்துச்சுன்னா, யூட்ரஸில் கட்டி வளருது, இல்லை ஃபேமிலி பிளானிங் பண்ணோம்னா யூ கேன் கோ ஃபார் லேப்ரோஸ்கோப். அண்ட் தென் ஆப்தல்மோஸ்கோப். ஆப்தல்னாவே என்ன, ஐ ப்ராப்ளம்ஸ். ஓகே, ரெட்டினா ப்ராப்ளம், எனி vessels problem na, you can go with ophthalmoscope. And then otoscope, membrane, tympanic membrane. Otoscope na ear, உன்னோட இயர்ல ஏதாவது ப்ராப்ளம் இருந்ததுன்னா யூ கேன் கோ வித் otoscope. ஸோ ஒவ்வொரு பார்ட்டுக்கும் ஒவ்வொரு டைப் ஆஃப் எண்டோஸ்கோப் நேம்டு. ப்ரோக்டோஸ்கோப், ரெக்டம். ரெக்டம்னா என்ன, end of your what to say, குடலோட end part is rectum. And then sigmoidoscope. Sigmoidoscope-னா என்ன, குடல் பார்த்தீங்கன்னா பெருங்குடல் சிறுங்குடல்னு சொல்றாங்க இல்லையா? ஸோ அதில் பவல் மூமெண்ட், ஸோ தட் வில் பி டன் by sigmoidoscope. And then thoracoscope, pleural activity. Okay, so based on the parts you are named the endoscopy types. So using all this, the diagnostic problem or surgery will be done on the particular part. An endoscopic laser coagulator we can see in next class. Okay.